So this is a beautiful summer evening and family has gathered, and at the periphery of the yard there are tiki lamps to illuminate the yard, but also to try to keep the mosquitoes away. Everything was okay until the adults are notified that there is a child at the periphery near one of the tiki lamps coughing. She's having trouble breathing. So this patient is a previously healthy 5-year-old girl who was brought in by paramedics in moderate respiratory distress. So the story goes that the child and her cousins were playing around the tiki lamp and they decided that it would be cool to make a wish. And so the child kind of pulled the tiki lamp pole down and some of the fuel kind of spilled on her face and onto her clothes, and she may have gotten some in her mouth and started coughing. Her oxygen saturation on room air was 92%. And remember, this child has no history of asthma, no past medical history, vaccinations are up to date, and she was fine prior to this incident with the tiki lamp. On exam, she has bilateral coarse breath sounds. Maybe there's some fluid in the lungs or some infection or something going on in the lungs. So we get a chest x-ray and it shows bilateral infiltrates, which is consistent with what we've heard. So she's treated with IV antibiotics, and of course she's admitted. Before she could get up to the pediatric ICU, her respiratory status deteriorated, so we had to intubate her. Her ICU course was complicated by a nosocomial pneumonia, and what that means is basically a lung infection that happened because she was in the hospital. And this is pretty common for patients who are intubated for a long period of time because, one, the hospital is very dirty, but two, when you're intubated, you lose your ability really to protect your airway, so you're more prone to getting these infections from the hospital. While she's in the ICU, she gets an echo to look at her heart, and it shows decreased cardiac contractility, which was likely due to cardiotoxicity from the hydrocarbon. And what that means is basically she has some heart damage and it's not beating, it's not squeezing as it needs to basically meet the needs of her body. Despite aggressive peds ICU treatment, including ECMO, they even put her on ECMO, which is basically heart and lung machine, where the blood is treated by a machine that does the work of the heart and or lungs, while her lungs and her heart rests and recovers. But all these therapies, they were not effective. This patient died on hospital day number 21. So let's talk a little bit about these tiki lamps. Every time I go into Home Depot or Lowe's at the beginning of the summer and I see these being featured in the garden section, I remember this case and several cases just like it. So basically the tiki torches have a fuel supply, which is a volatile hydrocarbon, which is burned, and that's what causes the flame. So what happens though is because it's volatile, which means that it goes from a liquid state to a gas state very easily. Not all hydrocarbons do this, but the ones used in these tiki lamps, they do. So when it gets close to the face, it spills on the clothes, it gets near the mouth or in the mouth, instead of just being heavy and sticking there, right? If you think like maybe petroleum jelly, just kind of sticks there. No, these are very, think of how alcohol feels, how it's cold and it evaporates really quickly. Well, these molecules are breathed in, they're inhaled. And these molecules get into your lungs and causes inflammation, which causes a lot of fluid to fill up those sacs, which means that now you can't exchange air. So those were the sounds that we were hearing. That's what we saw in chest x-ray. That's what causes the oxygen saturation to go down. But these hydrocarbons can also cause damage to the heart, right? That's called cardiotoxicity, secondary to the hydrocarbon. And the problem with this is now your heart is not beating like it needs to. So your lungs are not working, your heart is not beating, and it's very difficult to keep a patient alive when their heart and lungs are not working. So although everything was done correctly in this case, the child didn't make it. The reason why I'm sharing this case, though, is because I don't think that this is shared enough. But really, 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 you need to be careful with these tiki lamps, especially around children, around pets, or even around people who just kind of don't know, to keep them at a distance and keep the fuel that's in them well away from your face.